I'm very, very excited for this podcast episode, in particular because it is our first DO, right? Or osteopathic physician. Typically I have rehab professionals on here, but this next guest works in collaboration in a multidisciplinary environment with somebody who has served as a DPT student intern with us, now is involved in this business called Monarch in the West Hollywood area. This is Dr. Ryan Greene, and he is one of the managing members of Monarch. And we'll dive in a little bit to the intricacies of their model, how they do things. But nonetheless, Dr. Greene, welcome.
Thank you guys for having me. As I stated before, Dr. Marielle Schofield, our physical therapist, head of that department, speaks the world of you. And she said you're her favorite person on planet Earth. So, I'm honored to be here.
I appreciate that very much. And as you and I both know, as fellow Lululemon ambassadors, she's also a big fan of Lulu. But nonetheless, Monarch, let's talk about it, right? It started a couple months before the pandemic hit. LA is not a particularly easy place to do business over the past year. You all been obviously going through the paces, dealing with a wide variety of different things outside of opening a new business. But talk a little bit about the idea for Monarch, where that started, and the people involved, and then a little bit of your past 15 to 19 months.
Yeah, for sure. So the origin for the idea came from I was out training in surgery and orthopedic surgery in residency and was just looking around me, and I was like, this isn't a place where people come to heal. Like, they come to get fixed, but they're continually returning. Health isn't actually improving. And as a physician, I was like, I want you to do what you want to do for as long as you want to do it. So I started to grow disenfranchised with the traditional health model. A lot of my mentors were like, what do you do to train? What do you do to eat? Like, how do you stay fit even in residency? And so the idea started cultivating. I ended up opting to go do a fellowship in something not traditional clinical medicine. It was a little clinical. I went to Mayo Clinic, did some of that plus research, because I thought perhaps academia was where I could really change minds and like mold the future of healthcare. And it was a great experience. But I appreciated that the academic world, again, if you're doing something preventative, there's no money to support what you're doing, because there's nothing proprietary that pharma or a company can say, like, eating healthy, we're going to patent that. That's going to make us billions of dollars. So that I saw kind of like the end of the road coming, and had been cultivating this idea of like, why don't we bring multidisciplinary people together? And the truth is, I went to Mall of America and I was like, this place is amazing. It literally has everything here. Why don't we do that with health? Why can you not go to a place that has your doctor, that has your physical therapist, that can work on strength and conditioning, that can help focus on nutrition and foster a sense of community? Because I believe if you move well, if you take care of yourself, if you know what's going on inside your body, which impacts those first two, if you feed yourself appropriately and have someone to guide you, and then you also have a community to support you, your body will take care of itself. It's a very high functioning machine as long as we do the basic things right. And what I found is most people, especially that I was interacting with, were not doing at least one, usually a multitude of those foundational aspects. They were not allowing those areas to be solidified before they tried to do more complex things. And so I happened to have a colleague out here who wanted to put together a high-end private training model. And I was just like, what if you brought in a physician? What if you brought in a PT? And so we kind of combined those ideas about 4.5 years ago, and then developed what is now Monarch Athletic Club today, which is a subscription-based model, one-stop shop. Every member gets medical evaluation, lab work, body composition, nutrition, counseling, and guidance. They all see a physical therapist, Dr. Marielle, to do a comprehensive joint-by-joint evaluation. So by the time they actually start the training aspect, which is kind of the hook that gets people in the door, exercise, I think, is ubiquitous with health these days, when you and I would probably agree that there's a lot more that goes into maintaining a healthy lifestyle. But before they even hit the floor to train, we know what's going on inside of their body, anything that we have to pay attention to from a medical standpoint. How are they moving? What are the things they should do? What are the things that they shouldn't do yet? Like, what do we need to retrain? And then we combine that with a training program. And because it's a smaller environment, it's a membership-based model, we have a community that we can stay on top of. We can check in quarterly, which is our minimum follow-up period, if not more, depending on what the individual needs. And they have all aspects of a healthcare system at their disposal. So the sweet spot of what we do is, because medicine is the foundation, it's a medically directed facility, we also have the ability to tap into insurance benefits for some of the services that we render from a medical standpoint and a physical therapy standpoint, which we're kind of leading one of the first in the field to basically say, hey, Josh, if you're a Monarch member, yeah, this is what our monthly cost is. But if you work with a physical therapist, if you do those services regularly, as long as you're checking in with me, we can provide a super bill to help get you some money back based on services rendered. So it's unlike anything else. And people then appreciate, not only am I getting a good value just at the surface, but I can also actually make it a greater value because I'm leveraging these benefits that I'm paying for, but I usually never use. So it's kind of like that. You're putting skin in the game, but ultimately you're rewarded because you're happier, you're healthier, you're moving better, and also you're literally saving money in terms of what you're spending on health, if that makes sense.
No, it definitely does. I mean, I think for myself, I've always been a believer, right, that we need physical activity, nutrition, mindfulness, sleep, probably being the four big buckets. I think an environment where you can get a wide variety of different touch points that help you with process and also evaluate outcomes. I mean, that's best case. The word optimal comes to mind, right?
Yeah. So when I onboard every new patient, I'm their first stop. I'm just like, here's the deal. We touch base on all those things. How do you move? How do you sleep? How much hydration are you getting? Do you pay attention to your health? When's the last time you had an evaluation? All those things. And I get people in the mindset of like, what you're doing now, you're surviving for the most part, but are you thriving? Are you living at an optimal level? Do you know what that feels like? Have you ever been there? Some people say, yeah, like I felt the best 5-10 years ago. This is what I was doing, which is usually what we would talk about. They're eating well, sleeping, things like that. So part of our process is, how do we get you back to that optimal state of living for whatever it is for you? And that's something that we have the ability to kind of guide and plan in real time for these individuals, because everyone comes in with a different set of goals, but we're not, nor will we ever be in any one location so large that you fall through the cracks. So we can have a very customized approach. And ultimately, we're not doing anything super sophisticated. Like the tech that we use is fairly straightforward. We're leveraging the biometric wearables that already exist, Whoop or Polar, Garmin, Fitbit. We're just taking data that's readily available, but we're digesting it and presenting it in a customized, tailored program for the individual that just so happens to include more than what we see, especially in LA, which is training and nutrition. And I use nutrition with quotes because it's not usually a comprehensive nutrition program. So we've kind of brought together really good people in all of these foundational aspects and said, as long as you show up, we will make sure that you are being expertly guided to wherever you want to go.
I love this, and personally, it would definitely fit for me. I'm not seeing it as much as I would like. Obviously, there's a wide variety of different reasons as to why that is. There's a certain cost to entry. Obviously, there's a certain percentage of the population that is just more comfortable with accessing insurance benefits and going that route. When you have somebody who's interested in Monarch, right, and doesn't quite understand, I imagine there's got to be some kind of a psychology behind them transitioning from that uncertainty to certainty. What are some conversations that you have with people who you have their interest, and they're not quite sure whether or not this is going to be something that is impactful for them?
Yeah, absolutely. So one of the things that our marketing team has done a great job with is we put together kind of a value comparison sheet. And you're 100% right. LA is kind of like a mecca of health and wellness. People here are willing to do whatever, spend whatever to look their best, feel their best. If we opened in Chicago, where I'm from, would we have a similar result with our price point? Probably not. And that's like one of the things that we'll have to amend as we go, is figure out like, what is that skin in the game cost that's too high depending on the market. That's down the road. But for people here, we break down line by line. What do you work out? Yes or no? Yeah, I have a gym membership. What are you paying? This much. Do you get massages? You know, things like that. Do you work with a nutritionist? What do you spend on food? Like, what are your other costs that are associated with health and wellness? And most people out here spend a significant amount of money on their health. Our approach is we will offer all of those things in one spot with an integrated, well-coordinated program. We're significantly less expensive if you did it all a la carte, and you never have to start your cart twice. So there's a convenience factor of being able to show up and know that everything you need is in one spot. There's also the community aspect, which is an intangible. Within a couple of weeks, you know everyone. You start to develop personal relationships with members of all sides of the healthcare paradigm. There is absolutely something to be said about having a relationship with someone you're sharing sensitive information with, whether it's from a movement perspective, PT recovery, or medicine. There's a reason why people stick with their pediatrician all throughout their life. It's because they know who you are versus hopping around to different practitioners. So from a value perspective, we show you like, this is what you're likely spending now. This is what we charge. And then we also layer on the aspect of, this is what you stand to save, especially if you have insurance. These are the benefits that we can leverage. So here's your actual total cost. And then the final part, if people are still wavering a bit, is I have the ability with someone who has the knowledge to basically say, do you know what the actual cost of diabetes, heart disease, things like that are long-term? And if we get to that point, I can be like, here's the data that shows if you're overweight compared to normal weight alone, this is what you're on average spending year on year versus someone who just got their body weight better. Like, simple. And between all those things, we tend to have a high conversion rate from people that are kind of wavering to end up joining our facility. There's some people that are not going to believe spending more than X amount on a gym membership or a fitness or wellness membership is feasible. And for those people, hopefully our wave of momentum will continue and they'll start seeing more and more people come. And they're like, all right, there's a reason people are going there. Let me think about this again. Another thing that we did is we appreciated there's a sticker shock. There's a psychological factor that says spending X amount or above, I can't fathom that because it's never been done before, right? And so what we did is we introduced kind of an entry-level membership that includes less of the physical therapy training, things like that, but you still get your medical evaluation, you still get your PT evaluation, the nutrition. We'll still do those things every quarter. It's just a little less intense in terms of how often you're working with a member of the training team, the physical therapy team. And our belief, which has been successful so far, is once you get people in the space, they'll say, oh, shoot, like I want to do that. I love this. I love having that personalized attention. And they'll then be able to rationalize to themselves why it's worth spending, a little bit more money to get more of an in-depth program and offering delivered to them. So we kind of had to work with psychology, and that didn't come around until literally a few months ago when we were hearing conversations from people that are like, I love this. But when I tell people about it, they're like, I would never spend more than $1,000 a month on wellness. And when you really get down in the nitty gritty, if you look at everything, in a separate bucket, there probably already are, but there is a psychological hurdle to get people over. And so what we did is we tried to offer a little of like a stepping stone, be like, all right, try this program first, get a little taste, and then we'll, reevaluate. And most people have then progressed into our, traditional membership tiers.
Yeah, and I asked that honestly because we will see a lot of people in PT, especially younger PTs, in the push towards self-pay or cash pay.
Sure.
Who are doing it on a subscription model and multidisciplinary. So I think if anything, some of the listeners are going to really enjoy hearing some of the different considerations, hearing problems and the solutions that you've come up with. So that's, I just appreciate you sharing that. Some of the things that popped up, you're talking to people about chronic disease. You're talking to people about things that I think fall under this bucket of vulnerability, which we've heard far too often over the course of the last year. There was a big study that I'm pretty sure got posted today, and I'm drawing a blank on the journal that it was in, but associated with basic baseline health status and whether or not that was going to lead to having some kind of severe outcomes associated with COVID. Yeah. The thing that I think always comes to mind with chronic disease is things like obesity and diabetes or diabesity, and body composition is always something that's obviously in the conversation with obesity, whether or not it's body shaming, body positivity, a lot of things that I think people have been speaking to more and more over the past few years. And then the challenges associated with certain things like BMI. You use the word composition, right? Focusing on our makeup. I'm also very familiar that visceral body fat as a whole is something that has a high level of correlation with a lot of these chronic conditions. Can you speak a little bit on your experience or just your general thoughts on some of the topics I just mentioned?
Yeah. So it's hard to believe that we have gone this entire year looking at data of people that are having, longer term, more complicated, more severe issues with COVID and the underlying comorbidities that are associated with it. And I think the general consensus based on all the data is if you're older, which you can't control, kind of, if you're overweight, if you have other metabolic disease, heart disease, diabetes, things like that, the likelihood that you're going to have a more difficult disease course with anything, specifically COVID, there's a greater likelihood. The fact that we haven't shifted our focus on okay, those are controllable things. Let's control our controllables. Can we help with body composition? Can we help with chronic disease risk? Absolutely. The fact that 7 of the top 10 roughly causes of morbidity and mortality in the United States are lifestyle associated is mind-boggling that we haven't shifted our focus. But there's reasons that are, behind the scenes in terms of, money and funding and pharmaceuticals. That's a conversation for a different time. One of the beauties of what we do is, with the body composition analysis, I 100% agree with you. Weight, sure, it's an okay number to look at. BMI, very misleading depending on the composition of your body. But it's a valuable tool, at least for us, to guide someone to say, hey, this is where you're at. This is where we think you need to go. This is why talking about visceral adiposity versus superficial adiposity and the fact that the visceral is far more inflammatory, which introduces, a cavalcade of long-term, disease risk factors. Those are helpful. Also, pairing that with blood work to show someone not only are you overweight, but you likely are developing potentially non-alcoholic fatty liver disease, or your markers of inflammation are through the roof. This is why that's going to shorten your health span. And we use the word health span because lifespan isn't something that I resonate with, because we can make someone live to 100 years old, but is it a high quality of life? Maybe, maybe not. Health span is how long are you maintaining your health? Hopefully that's until your last breath. So we are able to put all those things together and show someone, these are the reasons why we are so adamant about introducing these various potential changes in your day to day, because most of our members are late 30s, early 40s, kind of that point where they're successful, starting families. I was like, you want to be participatory, and as much as you can for as long as you can. These are the things that are starting to pop up now that you may not notice bother you for the next 10, 15 years, but maybe 20 years from now, all of a sudden the wheels fall off and you are reliant on doctor visits, medications, treatments, things like that, things that pull you out of being able to participate in the things that you enjoy. And then we also share with them the costs associated with that, like I mentioned previously. So that's one part. The other part that we talked about, or you mentioned, was body positivity. So it's a very difficult discussion. And, you mentioned Lululemon, like they've kind of shifted how they market themselves to other people. Some people like it, some people do not. I think one of the things that I just want to remind people of is the general common complaint of the American healthcare system is it costs too much money. It's too expensive. Part of the reason is because our general collective health is continuing to decrease because of what we eat, how much weight we carry, lack of activity, sedentary behavior. The cost to you and me and anyone listening, that is shared amongst this massive pool of people that have insurance, which we're trying to get to be as many people as possible. So our behaviors, the things that we support and do not support, do have an impact on everyone else. It may not be, a direct impact, it may be indirect, but the things that we support in terms of lifestyle behaviors will change the course of what things cost, what can be delivered, what cannot be delivered in terms of healthcare. And, if we're upset about how much it costs to obtain health care, access, things like that, we have to look at ourselves and realize it's us keeping each other accountable so we can keep those costs manageable for the greater population. And that's a tough conversation because it's difficult to point out someone else's lifestyle and start to criticize or be judgmental, but we have to appreciate that we are all connected. The other thing that's different in the United States too, that I share with people is like our insurance system is set up for a 1-year renewable contract. If we were like any other country that has some sort of nationalized or socialized medicine, they're responsible for taking care of you from birth to death. So they have an incentive to support preventive medicine. We haven't got there yet. And that's going to be something that, people like you and I and others are going to have to push for, to say like, hey, we need to change how this medical support system works. Like, because right now, part of our inability to actively engage in successful healthcare practices is because at the end of the day, the people that are providing the coverage for us, all they care about is you survive 1 calendar year, and then they can say, we're not going to cover you anymore. So that's why they charge such a high premium. And most people don't really think about that, but that's something that we have to consider as well. And so I think I hopefully answered that question in multiple facets.
And it's, I just bringing up stuff that I've never really considered. I've never considered the fact that some kind of universal healthcare, because the government is more invested in it, that ideally they would be pushed more toward preventive services. Yeah. And then the yearly contract. Oh, I just need to keep you healthy for a year, and then maybe end up picking a new contract, you switch or whatever. Like it's not something where they're on the least.
And you may have not have appreciated this, but there was some data that came out recently that said by 2026 or 2028, our current Medicare system will have, its funding stores depleted, meaning like the number of people that are pulling into it, there will be no surplus at the end of the year. And that impacts a lot of people because we're getting older as a population, we're getting less healthy as a population. Like things need to change because our parents, our grandparents that are paying taxes into a system that ultimately is supposed to support them is going to become strapped for cash. And then how do you pay doctors? How do you pay PTs? Like it's going to impact the entire healthcare system, because if all of a sudden a lot of people need support for basic medical conditions, things that are associated with lifestyle, the way Medicare works is it looks at how many people need, treatments for certain things. And then they budget and say, 1 million people this year are going to need diabetes meds. So, the cost for a diabetes visit or something like that is going to drop because we have to make sure we can pay for that. For physical therapy, more and more people are going to be needing total hips, total knees. They're getting older. Rehab for that, because more people are going to be tapping into that system. Like, we can't keep paying $60 a visit. We're going to drop it to 40. So now all of a sudden, like, do you stop seeing those people because you're like, it's not worth it. It's not worth my time. Where do they go? Are they going to get good quality care? So there's a lot of things that from the policy side, we have to think about, and it comes from our behaviors that we are making today, because it impacts those decisions based on our current system for the next 10 to 20 years.
And you bring up the word decisions. It's so hard to have conversations, especially with people that are strangers, about whether or not their behaviors are counterproductive or in alignment with whatever their goals are. And
correct.
That's something that we see. I know, you kind of bring up the word reduction before. We see a little bit more of like a reductionist viewpoint in terms of, all right, what's the entry point to our four walls? Well, it's an injury, and our primary focus is surrounding that injury and then moving better. And although we think global with regards to how their body's coordinating movement, we definitely don't get to do it on the same level that you are. But I imagine a way to have that conversation is presenting somebody with a certain amount of objectivity, right? Objective data.
Sure.
What are some things that go into, having these conversations, having these challenging conversations? Is there something in particular that Monarch does that's unique, or just things that you're always thinking about when you get somebody that says, I want to go to Monarch for my New Year's resolution, and I maybe am not aware that some of the behaviors that I'm engaging in on a regular basis are counterproductive?
Yeah, I think in terms of tech, in terms of anything proprietary, I almost take pride in, like, our model is not complicated. It's fairly straightforward. What we've done is just brought all pieces of the puzzle together. Like, instead of you sending an eval note to a physician, like, that you don't know if it gets read or not, like, Dr. Marielle can just walk down the hall and talk to me and be like, hey, by the way, this is what I'm seeing. This is what I think we should do. And we can get it done in real time. So, like, those are some of the things that you could say are unique, but ultimately it's, we're not doing anything super technical or new age. I mean, we have the ability to use data to look at things such as, for your perspective, patients that are chronically injured. Is it because they're training too hard? Is it because they're not eating in a way that their body's recovering, and then what they're doing contributes to, chronic inflammation, subsequent injury? Is it sleep? Is it something from a metabolic perspective where I'm like, hey, there's something that's causing inflammation based on your lifestyle that's now manifesting in how you move, how you recover from movement, which is predisposing you for more injury. Like, those are the conversations that we're able to have with an individual so that they can truly understand the impact of everything that they're doing and its effect on them and achieving their goals, whatever they set for themselves. We have a lot of members, women in particular, that we're finding, and I guess men too, endocrinologic imbalances are becoming far more common. And part of it is lifestyle, sedentary lifestyle, what we're eating. But we're also finding, like, the quality of foods that we're eating, what's in them is impacting our hormone production. So we're seeing women with chronic overuse injuries secondary to an inability to maintain a healthy body weight. They're putting more stress on their system. They're not training in the appropriate manner, which are all things that we can address. But as we dive down and get, more understanding of what's going on with them, we find out their thyroid's poorly performing, which is impacting their metabolism, which is reducing their ability to lose weight, which is putting more stress on their system and causing, potential movement dysfunction or something like that. So, technically, like I said, I enjoy the fact that we keep it, like, very fundamental, knowing that when the body is well tuned like a car, it's going to do what it needs to do. And part of that is paying attention not only to the movement, and that's, from a PT perspective, strength and conditioning perspective, but also paying attention to what's going on inside the body. And we say every patient, your blood doesn't lie. What's there is there. When's the last time you looked at it? Most people say, 2 years ago, something like that. So, the last time I got a blood test was a year ago. And like, I have to take my own advice. I just have one that can draw my own blood, but that's a different story. So like, yeah, I think for us, it's putting a high value on the fundamentals and we happen to have everything in one spot. Layering on data, tech, force sensors, force plates, Whoop, things like that. That's great because it can show people objective, numerical value to what we're talking about. But ultimately for us, the beauty is consistency, compliance, oversight, and constant reminders and inputs on like, this is what you need to do. This is why you need to do it. Now you're seeing, the benefit and we'll remind you of that. Like that's Dr. Mariel's, principle, practice ethos is like frequent inputs, encouraging an individual to take control of their body and their movement and things like that. So they're not reliant on the system, if that makes sense.
Yeah, it does. And something that you had mentioned earlier, but still resonates with me and definitely applies here is, getting them to understand that there's a lot of controllables, right? And the more that they're able to control the controllables and ideally stack habits, put themselves in a situation where they're like aggregating these marginal gains from multiple areas, like
correct.
There's a compound effect. It's not that much different than ideally sound financial decisions. So it all makes sense. I think the thing that's challenging for at least some of the people out there listening, and I'd like you to speak to it a little bit, but if we're in a more siloed environment, right? Yours is not. Everybody's under the same roof. What are some things that you think that we should be more mindful of to know when potentially to seek out somebody like yourself or another member of your team to tag them in? Because it's not solely something that is more, and I'll put this in quotes, musculoskeletal.
Yeah. So that's a great question. If I was just to talk with someone and say like, hey, on a daily basis, like these are things that are not normal, right? Like chronic fatigue, chronic soreness, I'm trying to think, inability to lose weight. Like those are some simple things, especially if you're trying, you feel like I'm getting enough sleep, I'm trying to exercise regularly. I think I'm eating right, but my body's just not responding. I'm gaining weight. I'm feeling more tired. Like I just don't want to participate like I used to. That's not just I'm getting older, like something's going on there. Like we should be able to wake up, have energy to go throughout the day. The human body is designed to do two things. It's designed to move and it's designed to store fat. And like, if you're not able to move the way that you feel like you should be able to be moving, like let's dive into that and figure out why. Skin conditions, like skin conditions are a common one. I guess if you want to talk from like the medical side, when should you come see someone like me? Like if you notice as an adult, like skin doesn't look great, that is a sentinel sign that something underneath the surface is going wrong. Like the skin's kind of like the window to our internal physiology. So if things like that, hairs falling out, blemishes, acne, things like that as an adult, those are a lot of things where I would say, hey, like you should pay attention, and go talk to someone. The other thing from like a nutritional and digestive side, we get a ton of people who come in and they're just like constipated all the time, bloating, things like that. We should be able to digest food. We should be on a rhythmic pattern in terms of like bodily function. So if we're not in a rhythm in any part of our life, I would start paying attention and be like, all right, I may need to go get some, higher level advice here. Hopefully that answers your question. It's a little bit nebulous.
Absolutely. I think that sometimes
sleep too. Sleep's another one. People that come in, they're just like, I can't sleep, or I don't get good quality sleep. Like, why? Yeah. Everyone needs to sleep. That's like, I actually had this thought the other day. I was like, isn't it interesting that every animal on earth, whatever, mammal, or otherwise, we all sleep. Like, it's so important. So when someone comes into me and is like, I can't sleep, why? Or if,
Right.
if you're finding like, I can't get sleep, I can't get good restful sleep, that's something that I would address first, because that's probably the most beneficial thing for our overall health is a good night of sleep. So those are some things that I would recommend.
No, it's great, because I think as we develop relationships with people, they maybe allow us to become more a part of their life, and we become privy to certain things that they mention. And sometimes maybe it just goes right over our head, and we've been working with this person for X amount of time, and they're just not improving in a typical practice pattern that we're familiar with. And it may be an opportunity where, because we have some of the awareness to things that you mentioned, now we're able to have different conversations. We're able to steer people and ideally help a little bit more than maybe we had in that solely that siloed environment of just musculoskeletal based care. So I'm going to spin this back to you for just kind of the final little block here. What are some things that you're working on both personally and professionally? And you can answer one or both.
I think I'll start with personally first. Taking my own advice. And I just had a conversation before this with some colleagues, and about making sure we take care of ourselves first, so we can help other people. And someone who's started a business like yourself, like, it's very easy to get wrapped up and be like, I'm going to work 16, 18 hours a day for the next 3 to 4 years just to get everything going. I guarantee the quality of your life, if you're objective with yourself, which it's difficult to be, you're probably not taking your own advice. And in terms of your longevity, your ability to continue, it will be compromised. And that's the truth. Like, we're not super people. Anyone who's starting a business, like, or you're doing anything, like, you have to take care of yourself first. So that's, for me, is finding harmony in everything that I'm doing, because there's a million things going on. Setting boundaries and telling myself, like, I need a day a week just to, like, recharge, and making that a priority, because then we can keep doing what we're doing for a long period of time. I literally, as we're having this conversation, I bought my first mattress I've ever bought in my entire life, which is like it's a huge, like, why, like, sleep is a huge thing. I tell everyone about it. I just never invested in like a reasonable mattress. I just kind of like brought whatever I had. So I'm learning that as we go. So that's an important one for me, is taking time for myself, finding harmony in my life. Professionally, working on how we can continue to grow, scale, and expand this idea, this model, beyond just brick and mortar facilities, because ultimately there are billions of people in the world that would benefit from the work you're doing, the work we're doing. How do we get it to them in a way that can provide tangible results? Like, there are great platforms on Instagram that will show you, like, you guys do great work. You provide a ton of incredible evidence, but how do we integrate that evidence into daily practices? Like, what are the things that we can do to provide support, encourage compliance? And, from our perspective, it's taking this model and not only expanding physically, but figuring out, what we're doing right now is a virtual platform that says, if you're in Maryland and there's not a Monarch brick and mortar, how can you use our program? We've developed a finger prick blood test. Like, how do we get the recovery aspect executed in terms of a virtual modality? So those are all things that it's just never been done before. And so that's kind of where our focus is streamlining what we're doing, so we can not only continue to scale and expand the physical facility, but also our footprint, virtually, so we can have a global impact potentially.
I love it. My headspace, at least right now, goes to media, whether or not that's like, your podcast, newsletter, courses. I'm sure some stuff that you're already having some internal conversations about. So I will look forward to seeing some of that, because it's something that this topic interests me. If I wasn't doing rehab to perform, I could very easily find myself working in an environment like you have. So
we would hire you. So absolutely.
I appreciate it.
So I mean, ultimately it's going to be more people like you and I, like Dr. Marielle, and the people that, you're working with. It's just, right now we just have to continue the conversation to start to wake people up to the fact that like there's more that needs to be done so that we can, rising tide lifts all boats, so to speak, and bring people, to health together. Because ultimately, like I said, a little bit ago, everyone's decisions impact everyone else, whether we see it in real time or not. So we kind of have to open that collective consciousness of like, your health affects my health, vice versa, and then the people around us. So that's just what we need to do.
I'm with you. And that thriving instead of surviving is going to definitely stick out with me from this conversation. So
great.
Ryan, just to put a bow on things, where can people connect with you? Where's the best place for them to, continue the conversation?
Yeah, absolutely. So my Instagram handle is Dr. Greene _DO. I don't know if you feel free to put my email in, the show notes, things like that. People can email me directly. Monarch Athletic Club, it's at Monarch WeHo. And then our website is www.monarchweho.com. Feel free to reach out to me through any of those platforms, or if there's any of our staff members that you want to work with. Like, we're a small yet mighty group. And I know that everyone on our team has a similar passion to myself to help expand this, this health narrative. So do not hesitate to reach out.
And for anybody listening who is in the LA area or wants to make it a weekend trip, we will be coming to LA in a couple months here. I'm very much looking forward to meeting you, seeing your face. I'll actually be coming out early. So hopefully, we'll get some off hours conversation as well. But nonetheless, thanks again for your time today. And I'm looking forward to, finally meeting you in person someday.
Yeah. Thank you for having me, and thank you for doing what you do. It's sorely needed.
Thanks.